Okay, so this is a really interesting case. The anonymous person behind the towel here is Sandra. Sandra's got an interesting case of vertigo. And what we're trying to do is we're trying to actually treat all the different things which might feed into her experience with vertigo. And one of the things is treating her sinuses. We know that the sinuses and the inner ear, definitely the inner ear definitely is involved with balance. She has a sense of being out of balance, and at times it's been quite bad. Is that correct, Sandra?
Yeah, that's correct.
Yeah, gotcha. So the reason we've got all the towels and things set up here is that we want to try and make sure we get a really good seal. So because I'm going to be treating right near her eyes, I have to make sure I'm keeping her well shielded from the laser light because it's very bright. It's so bright, in fact, that even though we shield the eyes directly, and of course Sandra's got her eyes closed, we've got a towel over that, and we've got the goggles over that. Even though we've got all those different levels of barriers, the light is so intense, so bright, that Sandra can actually see a bright light inside her head, basically. I've actually treated my own sinuses in the past when I just had sinusitis. You probably tell from my voice that I tend to be a bit sinusy most of the time, and that is the case. Occasionally it gets to the point where it's quite painful. And I found that treating my own sinuses, so basically up here, down here, I can actually get them to drain really quickly. This is a known application of the class 4 lasers. Really effective for taking away people's sinusitis. So interesting, this is Sandra's third session. Can you, just from underneath the towel there, Sandra, yeah. Can you just tell us what's been your experience after the first session? What happened?
I felt a lot better, not as dizzy, and my head was not as cloudy, very clear.
Gotcha, excellent. She did have a little bit of a headache, which we expect. There's an increase in blood flow. The headache passed, but she felt better subsequently. Am I correct in saying so?
Yeah, that's right.
Yeah, gotcha. Okay, after her second session, how was that?
It was even better, yeah.
Even better.
Improving each time.
Yeah, gotcha. So this is the third session. So what we'll do is we'll just give you a quick little look at how we treat sinusitis. And in the case of Sandra, we're actually hopefully, and well, we obviously are, having the effect that we're looking for, which is to actually improve her vertigo symptoms. So anyway, have a look at what we do, and just give you an idea about how we treat sinusitis. I think it's really interesting. It's fascinating that we can actually treat sports injuries and arthritis and sinusitis and all these other things with the laser. So in the case of Sandra, this is really helping. So let's just get on with the treatment. So currently the best evidence we have is that 200 joules treatment of the sinus actually delivers adequate energy to achieve what we're trying to achieve with sinusitis. Right, so just continuing on Sandra's treatment, we're just treating right around the ear. Alright, so we finished Sandra's treatment, and as you saw, we treated basically about 3 different areas on each side of her head. We treated these sinuses on either side, these sinuses on either side, and then we treated around her ear. Okay, so basically the goal is to try and improve her vertigo. Seems to be we're having a good effect. Now, we really don't know at the moment if that's to do with her sinuses or whether it's treating around her ear or even treating around the temporo mandibular joint, which we're capturing when we go around her ear. All those structures can be involved with vertigo. So, as well as the brain itself, there's lots of factors to vertigo. There are specialist clinics, which we will generally refer to if we think it's like a neurological issue. So anyway, we've applied the laser. And the good thing is that even if we're treating areas that aren't affected by having this sort of the shotgun approach, even by treating the areas that aren't affected, there's no problems because laser's really quite harmless to healthy tissues. So anyway, we'll track how Sandra goes, but so far so good, yeah?
Yep.
Excellent.
Good. Yep.
Excellent.
Nice and
Good
relaxed.
stuff. Good stuff, yeah. She's been lying there with her eyes closed for about the last 10-15 minutes, so yeah, we all just want to just go and have a snooze.
Yep.
Anyway, all right. Thanks a lot.
Thank you.